Hi there, I'm Naita, and I'm here to talk about 7 things you should know before you have strabismus surgery, or 7 things you should be aware of before having strabismus surgery. So I had strabismus surgery exactly 4 weeks ago today. And as of now, my eyes feel a lot better. I still have some redness on both eyes on the outside. And the muscles, just looking left to right is still a bit of a challenge, but I'm back to work and things are, going well. But thankfully, it's getting ready to be Christmas break, so I'll be off for a couple weeks. So, 7 things you should be aware of. Number 1, make sure you understand the procedure you're about to have. And I say that because my right eye, I had strabismus surgery because my right eye started drifting. I started losing muscle in the right eye, and the right eye would just start drifting all on its own. And I could even be driving. So, because I would be driving, all of a sudden the eye would shift to the right. I wasn't seeing clearly. I was seeing things next to me that weren't there. So, we had to do something. I had to have surgery. I met with my surgeon 3 times before I had surgery, and we kept talking about the right eye, and what it's doing, right eye, what it's doing. But I never made the connection that in order for the correction to be sustainable, she also had to do the right eye. I'm sorry, the left eye. So when I woke up from surgery, and not only had I had surgery on the right eye, but I also had surgery on the left eye. Therefore, I had stitches and patches on both eyes and crazy pain. Okay, crazy pain. So, step 1, make sure you fully understand the procedure that you're about to have. Number 2, that you really need to be aware of when you're having strabismus surgery, especially if you are someone who has a little bit of age on you. If you're in your late 40s, 50s, 60s, then there's some extra things you should be aware of. And that leads again to number 2, is that there's going to be significant drainage. You're going to have drainage coming from your eye or eyes, and that fluid is going to also have blood. So you're going to have streaks of blood running down your eyes. So it is a bit alarming. It is a bit strange to look at. So having gauze with you, I had gauze. I also had tissue, but I stayed away from tissue because tissue has a little bit of debris. So I just used the gauze, and it's soft. So I was happy with the gauze for the first week or so. But also understand that because of the drainage, it then starts crusting around your eyes. And this is significant at night when you are asleep, because when you wake up the next morning, which is point number 3, your eyes are crusted shut. So for me, it wasn't just one eye being crusted shut, it was both eyes crusted shut. And so not only are they swollen, not only are they crusted shut, but they hurt also. They hurt. So take your medicine. Take your medicine. The first couple days, the pain is significant. After that, it subsides substantially. It really, really does. But the crusting is real. So I would suggest that you invest in some white washcloths, just some white washcloths, some nice thick ones, so that you can start wiping away the crust. And it's crust, so you kind of have to be gentle, but you still will have to work at getting the crust off of your eyes to open the eyes. Then, of course, you open the eyes and they're bloodshot red.